Hello everyone. I am Paula Evans, pharmacist from MCPHS University Pharmacy Outreach Program, and thank you for joining me today for the presentation on medication safety for older adults. It's nice to be back and presenting to you in the community. Of course, for the spring and summer at least, this is one of the safe ways of staying connected, video. Perhaps you have been at your senior center or housing area when we have been there and recognized the name of our program. You've been there in the past and seen us come out to present to you. We have presented at many of the senior centers over the years and have seen your smiling faces. However, in Massachusetts right now we need to abide by the new guidelines, and today we need to stay home as much as possible. Safer at home is the new advisory, but we can still stay connected. Before I get started with today's talk, let me tell you a little bit about the Pharmacy Outreach Program. We are a free information and referral service to help Massachusetts residents take their medications appropriately, and we do this by helping you obtain and afford your medications. We also help you understand the medications you take. We are located at the MCPHS University College of Pharmacy in Worcester. We're able to offer these benefits for you through support from the Massachusetts Executive Office of Elder Affairs, the City of Boston Age Strong Commission, the Central Massachusetts Agency on Aging, and the school itself, MCPHS University. Let's say that you have a question about your medications and you're wondering, how do I connect with the Pharmacy Outreach Program? A few different ways, and let me highlight them for you. You can call our toll-free line 1-866-633-1617 Monday through Friday. You can go onto our website and utilize our Ask the Pharmacist feature, where we can answer your questions via email. The website is www.mcphs.edu/pharmacy outreach. Again, you can utilize Ask the Pharmacist feature to get our help with your medication questions. And when no health advisories are in effect, you can connect with us at outreach events. We go out throughout the state and do programs, and we would certainly be very happy to get into that again and be able to go out and do outreach programs. Our staff includes case managers that are SHINE trained, geriatric certified pharmacists, and pharmacy students. Currently, our students are taking online courses and helping us on an online capacity.
This red card is our signature card for the Pharmacy Outreach Program that highlights how to get in touch with us through our toll-free number 1-866-633-1617. We are answering calls and willing to help just as we have in the past. We have these red cards for distribution in the community, and you could ask us to mail you one that you could display at home. I would suggest calling this number listed here and asking for one if you would like.
So what do we do at the Pharmacy Outreach Program? Well, we typically answer questions about your medications or diseases. We certainly could do that. We could look at all of your medications on your list and provide a one-to-one medication review, looking at everything for drug interactions or seeing if you have any particular side effects that you have questions about. We can also research ways to save on the cost of your medicine. So we would look at your insurance plan, we would look at your Medicare D plan if you have that, and we would look for the most cost-effective options, listening to what you have that is expensive for you. We also go out, as we say, and educate at community events on many health and prescription assistance topics, but that is currently on hold. Today I will go over some simple tools to help you manage your medications and their costs. I will also help you understand just how important it is to take your medications regularly. You must be adherent, and that's what taking them regularly means, and to be safe in taking them. Again, taking them regularly and taking them safely. Let's look at some programs that might help you cut your medication costs. Medicare Part D. Many of you use Medicare Part D to cover your medication costs. Medicare prescription drug coverage can be for those over 65 years old, but it can also be under 65 if you're collecting disability. Medicare drug plans are provided by private insurance companies. They cover prescription brands and generic medications. They also may cover syringes used to inject insulin. Some of the plans, certainly not all of them, but SilverScript and Humana are two of the plans. Information on Medicare Part D can be found on www.medicare.gov or call 1-800-633-4227. I'd like to highlight the shingles vaccine, as I believe it is a very effective vaccine in the older adult and can help you from getting shingles. It is covered under Part D, and I'm talking about the new shingles vaccine. The Shingrix is probably what you are maybe familiar with. It's a two-part vaccine, and it's given 2 months apart. This vaccine is different than the Zostavax vaccine, the one shot. That was the live vaccine that was available up until about 3 years ago. It's still available today, but the newer Shingrix vaccine is a better vaccine to cover shingles. This Shingrix vaccine is very effective in preventing shingles, about 95% effective. So if you have had the old vaccine, Zostavax, you should still get the Shingrix vaccine. If you have had shingles, you can still get the vaccine. You can check with your physician to determine if this vaccine is acceptable for you, and if it is administered by your pharmacist. During this period right now, during the pandemic, however, the pharmacist may not be giving the vaccines. However, this information is something that you may be able to use in the future and discuss with your doctor at your next doctor visit. So how can we help with Medicare Part D? If you needed assistance with that, what would we do for you? We would look for the most cost-effective plans for the medications that you take. We would look to see about the medicines that are on that plan and see if there's any lower cost medications on that plan that you might be able to utilize, an alternative medication that may be effective. We would find help for you with the cost of the medications in the deductible, the coverage gap, or with medications that are not covered. We work in conjunction with Prescription Advantage. You may have heard of Prescription Advantage. It is a wonderful program for Massachusetts residents, and we are especially fortunate to have such a program in Massachusetts. Many of you may have Prescription Advantage or have heard of it through your senior center or your Shine counselor, but I'd like to just describe a few pointers about it that just make it so helpful. It is a state-sponsored prescription insurance plan. It is a secondary payer to Medicare Part D. So you would utilize your Medicare Part D plan first, and then it fills in the donut hole by offering medications at a copayment price. So Prescription Advantage actually helps you lower the costs in the donut hole. It is free for most people. If you have income limits up to $62,450 for one or $84,550 for two, you may qualify for Prescription Advantage. It is definitely worth a call to 1-800-243-4636 option 2 to see if you do qualify. You could also call our service to have us help describe to you if Prescription Advantage would be effective for you and what the benefit would look like. An awesome program that I highly recommend you take advantage of and look into for yourselves. Earlier, I talked about taking your medications safely, and for those of you taking medications, here are some tips to help you do that and help prevent you from being over-medicated or having a bad reaction. Number one, be aware of any over-the-counter medications that you take. Medications that you buy in the pharmacy or grocery stores that you do not need a prescription for, such as ibuprofen, aspirin, multivitamin. Why do I stress this? Because these medications could interact with your prescription medications. Therefore, if you are using them regularly, they should be part of your medication list. Number two, you want an updated list. May be able to get from your doctor's office or your pharmacy, or create one for yourself. Number three, ask questions about your medications to help you understand. The more you understand your medications, the more likely you are to understand that you need to take them regularly. I suggest before a visit to your doctor, write down your questions, as a good question list may help save time at the doctor's office. Number four, follow directions. Read the labels on the bottle and follow the directions. If the label differs from what you are doing, then ask your doctor or pharmacist for clarification. If it differs because the directions are old, ask to have the label updated. Number five, let your pharmacist or physician know if you have any concerns that come up or experiencing an adverse problem you have not had in the past. As an example, you are now getting very dizzy when rising from a chair, and you did not have that problem in the past. You would not want to fall, and you would certainly want to talk about this with your physician. Let's look at some additional safety tips. Number one, use one pharmacy. The benefits of using one pharmacy is that pharmacy then knows all of your medicines and can put them into the computer and check for drug interactions. If you're buying medicines at different pharmacies, then nobody really is seeing the true overall picture and checking for interactions. So if you can, use one pharmacy. Number two, double check the label and contents of the bottle. Has the tablet appearance changed? As noted before, are the directions the same as what you are taking? Number three, never take medications in the dark. That kind of speaks for itself. Or taking them, if you're used to using reading glasses, then you'd want to make sure you've got your glasses on and you're taking the medication that you should be taking. Never share medications. You may think that your friend is taking this drug, it's very expensive, you're no longer taking it, but strengths may be different. Some medications have 3 or 4 different strengths, and you certainly wouldn't want to be substituting different strength for one of your friends and making them have a reaction. Additional safety tips, medication checkup. So remember how I stressed the need for keeping an up-to-date medication list of prescriptions and over-the-counter medications. You want to stay organized. So you'd like to ask for a review from time to time from either your physician or your provider or your local pharmacist, or utilize the services of our pharmacy outreach program. We have a service that is called medication management, and you can call our service and we would look at all of your medicines for you. We would look at the strengths, we would look at what time of day you take them, and we maybe could make some suggestions on how you could be a little more effective in remembering to take your medications, or what times are the best times for you to take them, or particular questions you may have about any one particular medication. So I highly recommend utilizing our service. I am a pharmacist that is geriatric trained, and I do have a certification in geriatric pharmacy. I have another pharmacist that works with me that is also certified in geriatric pharmacy. Another safety tip is to clean out your cabinet regularly. I'm going to talk about how to destroy medications in an upcoming slide, but you want to make sure that you're just not confused with too much clutter and only be having there the things that you are taking. Proper storage. The best place to store medications is in a cool, dry area. So storing medications in a bathroom that has a shower that everybody is using throughout the week and the day, there may be too much humidity in there for that. Many people keep the medicines on their kitchen counters or in their kitchen cabinets. That may be a better place, but again, you do need to be cautious about where you're keeping it and the visibility of it with people coming into your homes. You certainly want to make sure that the medicines are out of sight of children, that they wouldn't be climbing up on chairs and getting into some medicines. If you have pets that are taking medications, we advise that you separate yours from the pets. The other point I always like to highlight is that it is a good idea to just be cautious of people coming into your homes, that there may be people looking for medications in your pocketbook, or they may be looking, if they're using your bathroom and you're keeping your meds in your bathroom, they may be going in there. People will sometime take out a few tablets out of a vial, and you think that you wouldn't know that somebody had taken something out of your vial because they're only a few tablets, but they may be able to take those medicines out to the street and sell them. So you want to be careful of people coming in to clean your homes, people, if you're selling your home, people coming in to look at your home. Just a word of caution to all of you. If you're splitting tablets, if that's what your doctor has recommended that you do, if the tablet is approved to be split, the tablet will be scored. You'll see that. You would only split the tablets that you intend to use now. So the best advice is that you don't split your tablets for the whole month, but that you split the tablets as you need them. Split tablets may be affected by heat or humidity or moisture content, so they may not be as potent as they would normally be if they weren't cut and if you're keeping them for the whole month. Most, and this would only make sense, most sustained controlled time-release medicine should not be split. If you have any questions, that's another question that you could call our service for and ask if your particular medication could be split or could be crushed, put in some liquid, or put in some applesauce or pudding. So you'd like to get rid of medicines that you do not need. Police stations typically have been taking discarded medications. They have these mailboxes in their lobbies, and you would go in and put in your medicines. I know that during this pandemic period that is, most police stations are closed to bringing in medications for disposal. Rite Aid does have a Dispose RX powder. It is supplied with all new opioid prescriptions, and every 6 months for chronic users, you mix the tablet, you add water to dissolve it, and then you would put it in your trash. Other ways that you could do it is just doing it at home. You could take your tablets in your vial, put in some kitty litter or some liquid, and just dissolve the tablets, and then you would scratch out your name and the name of the drug, put the cap back on, put it into a plastic bag that you could twist tie, and then you could put that in the trash. You just do not want to be putting medications down the toilet or down the sink. I'm going to go over some medications that older adults should use with caution now. Because Older adults often experience chronic health conditions that require treatment with multiple meds. There's a greater likelihood of experiencing side effects of these medications. Older people can also be more sensitive to certain medications. Perhaps your kidneys aren't functioning as well and you're not eliminating the drugs as you should be. To help you make better informed decisions about your medications and to lower your chances, the American Geriatric Society has recommended that older adults be cautious about using certain medications, including some that can be purchased without a prescription, over-the-counter meds. So let me go over a few of them. The non-steroidal, NSAIDs, stands for non-steroidal anti-inflammatory drugs. They are used to reduce pain and inflammation, such as ibuprofen, which is Motrin, or naproxen. You should avoid regular long-term use of these drugs, especially use them with caution if you are at higher risk of developing a bleeding stomach ulcer, such as being over 75 years old. You may have a higher risk of having that. Or if you're taking oral steroids like prednisone, or if you're taking some type of a blood thinning medication such as Eliquis or aspirin or Plavix or Coumadin even, or Xarelto. Those medications, in addition to taking an NSAID on a regular basis, could be problematic and cause a greater chance of having a bleed. As I said, you should also use caution if you have kidney problems or a heart failure. So NSAIDs in general can increase the risk of bleeding stomach ulcers. They can also increase blood pressure, affect your kidneys, and make heart failure worse. If you have any questions about using NSAIDs on a regular basis, you could certainly call our service or you could talk to your doctors. Occasional NSAID use for a headache or a muscle ache or a pain may be certainly appropriate, but long-term use of these medications in older adults, especially certain older adults with stomach ulcers or blood pressure problems or kidneys or heart failure, you'd want to be cautious about using that. The second drug listing there is some diabetes drugs. So what I'm talking here is the med Glyburide. Glyburide is an old medicine for diabetes. Many people are on that medication and may still be on that medication. You may be certainly taking it appropriately. This medication, though, can build up in your system over time and be a little bit longer in getting eliminated from your system, and because of that then can cause low blood sugars. So you have to be careful with Glyburide. This is definitely a question that you could ask your doctor. Is there a safer alternative that I could be using? But you just need to be careful of low blood sugars with Glyburide. So that's why it's on the list. Remember that these are medicines that older adults should use with caution. Doesn't necessarily mean you need to get off of the medicine, but you have to use it with caution. The third grouping of medications is for anxiety or insomnia. So the anxiety meds that are very long acting and that would definitely be a problem because they could increase your risk of falls as well as cause confusion is Valium. Xanax is another one. The sleeping meds that may be causing falls or confusion is Ambien or Zolpidem, Sonata, or Lunesta. That's another one. So in general, these can increase your risk of falls as well as cause confusion. And that's all because it takes your body a long time to get rid of these drugs. These effects can carry into the day after you take the medication. You may wake up after taking an Ambien and feel very groggy. So again, if you're on these medications, you may want to have a discussion with your physician and just how might I be able to get off of these medications. The fourth grouping there is diphenhydramine. If any of you know what diphenhydramine is, it's Benadryl. It's an old antihistamine. It's one that is readily available in the pharmacies. And newer products that have come out um, are so much, the newer antihistamines are that much better because they are not long acting. This particular medications, you don't need a prescription for it, so people can readily go in and get it. But diphenhydramine can cause confusion, blurred vision, constipation, problems urinating, and dry mouth. It is in products like Tylenol PM. In the next slide, I will show you a few products that diphenhydramine is part of the component of the drug. So if you can, you want to avoid the antihistamine diphenhydramine. So be careful buying certain over-the-counter medications. As I mentioned, diphenhydramine Benadryl is Tylenol PM, it is Advil PM, it is Motrin PM. They all contain diphenhydramine, and sometimes the amount in there could be 25 to 50 milligrams, which is quite high. It's also in ZQuil. Again, it can cause confusion, blurred vision, and increase in falls. When buying Tylenol, it may get confusing. They make a lot of different products. As you see, the cold and flu or the PM. If you're not sure what it is that you want, if you want just the pain medication, then all you really want is the acetaminophen, which is Tylenol. You don't need any of these other components, and that could cause troubles for you. So next up, I'd like to start talking about proton pump inhibitors, or PPIs. So what are PPIs? What are they all about? They are a group of drugs that lower the amount of acid in the stomach, and they're often used after antacids or H2 blockers such as ranitidine or Zantac or Pepsid. Examples of the PPIs include Prilosec or omeprazole, Prevacid or lansoprazole, Nexium or esomeprazole, or Protonix, which is also pantoprazole. Maybe some of these names sound familiar to you. They are available by prescription or by over-the-counter. They are good for heartburn or GERD and ulcers. GERD is gastroesophageal reflux disease, so that burning sensation that you may feel from your stomach up into your esophagus. The OTC product is indicated for 14 days of therapy. You can easily go in and buy a supply for 14 days, but the prescription product may be prescribed for GERD or stress ulcers in the hospital. So maybe you've been in the hospital and been put on a proton pump inhibitor and still on it when you get home from the hospital. Because they change the acidity of the stomach, they may reduce calcium and magnesium absorption. And over time, they can increase the risk of fractures and affect bone health. So they may also increase the risk of pneumonias and other infections. These are not common, especially with low doses and short-term use. However, it is a good question for your provider to discuss the length of time you need to be taking these medications. So how should I take the proton pump inhibitor to get the maximum benefit from the drug? If you take a PPI once a day, take it 30 to 60 minutes before breakfast. If you take it twice a day, then take the second dose 30 to 60 minutes before dinner. Your stomach makes acid when you eat, and taking the proton pump inhibitor before you eat stops extra acid from being made. I suggest that you assess your need for the medication, and if you want to try to get off of the medications, that you follow a taper schedule though. This helps to avoid an acid rebound and have your heartburn return. So I would suggest if you're taking it twice a day, go down to once a day for a week. Then if you're taking it once a day, you could go down to every other day for a week or two, and then decrease it from there. It may take you a month to get off of these medications, but if you don't do it this way, you'll get the rebound, and then you will not want to get off of the medicine. So during that time frame that you're trying to taper down, you may be antacids or the H2 blockers, again like the Zantac or the Pepsid, may be used during that time if you have symptoms. What else other than medications can I do to help prevent heartburn? Suggestions are pretty standard. Don't eat 2 to 3 hours before bedtime. Raise the head of the bed 6 inches. Stay at a normal weight. Quit smoking and avoid foods that seem to make it worse. So now I'd like to cover just a little bit on calcium and vitamin D. Many people use calcium and vitamin D, and this is always pretty helpful information. So why do you need calcium? Why do you need the vitamin D and the calcium? Because they're needed to keep your bones strong. Nerves, muscles, and blood vessels need calcium to work, and vitamin D helps the body absorb calcium. So that's the whole point of the vitamin D, helps to absorb the calcium from the food that you're eating. Good sources of calcium and vitamin D. Calcium is found in foods quite a bit. Some foods may contain about 300 milligrams of calcium per serving. So milk is good. Low-fat yogurt is good. Calcium fortified soy milk, cereal, fruit juice, breakfast bars are also good. Vitamin D is found in foods like canned salmon or tuna or egg yolks. Vitamin D fortified orange juice, milk, soy milk. Again, a lot of those things are fortified. Fish is good for vitamin D. Grains are also good. And sunlight. We need a certain amount of sunlight, so it's good that the spring and summer is here. So do you need to take a supplement? Sometimes it's hard to get enough vitamin D from food, so most people need a vitamin D supplement, and you may be buying those little gel caps. Ask if you should have a vitamin D level checked. Many people do have that checked on an annual basis. What vitamin D are you going to look for? You want to make sure that it is a supplement that is USP verified, and it would say that on the label, USP verified. Many of those that are being sold in the supermarkets or pharmacies are USP verified. Vitamin D you're going to find comes in a vitamin D2 or a D3. Either can be used, but vitamin D3 is the most popular. That's the one that you would see most often for sale in the pharmacies. It's good to keep an eye on it and buy one bottle, get one free. Some of those special deals are very helpful. How much do you need a day? So for calcium, for women older, 50 years old, or men over 70, 1,200 milligrams a day is needed for calcium. A lot of that can, however, be gotten from food. A cup of yogurt has 300 milligrams of calcium in it. So most people in their diets can get adequate amount of calcium per day, and maybe they don't need a supplement. That's a very good question for your doctor when you go and see, do I still need to continue with my calcium supplement? The vitamin D, most experts recommend that you get between 800 to 2,000 units of vitamin D a day. Sometimes that is a little bit more difficult, and depending upon what your vitamin D level may be, the doctor may tell you that they want you to use 1,000 units per day or 2,000 units per day. But multivitamins may have vitamin D in them. They may or may not. If they do have it in there, sometimes it's only about 400 units per day, so you may need to take some additional vitamin D. I'd like to thank you very much for listening today. I hope it was helpful to you. I hope we have also offered a service to you that you may be able to take advantage of, and I highly recommend that you call our service if we could help you. Again, my name is Paula Evans, and from the Pharmacy Outreach Program. Thank you very much.